Hello, beautiful people. I am Jessie Santiago, a certified clinical hypnotherapist, Reiki master, and educator, also a hairstylist of over 20 years. So, today I want to talk to you about what the difference between hypnosis and talk therapy is. And first and foremost, I just want to start off by saying that hypnosis and talk therapy are not in competition. They are complementary to each other. And I am a very, very big advocate of therapy. Sometimes you might hear me talk a little shit about therapy. And that is not because I don't think that therapists and therapy are helpful. I just think that it's a bit antiquated and a little Eurocentric. And so, if that doesn't vibe with you, you're probably not going to want to stick around here. But if you can kind of get down with that, then hang with me for a little while. The data is really promising when it comes to subconscious work and embodiment work, somatic work, and even indigenous work. So I think that if you stick around a little longer, maybe do your own research, you might find that we probably agree a lot on a lot of things. So, talk therapy focuses mostly on the conscious mind. It focuses mostly on analyzing and reflecting and making sense of experiences that have happened to us. It gives us language, which is incredibly important to understand what happened to us. And I think it's also really important to say that therapy, mental health work, talk therapy knows about the subconscious mind and knows that there is a subconscious mind, but doesn't really work within the realms of the subconscious unless you're working inside of trauma therapy, which is like EMDR. Even internal family systems, IFS, does a little bit of subconscious work too. But hypnosis works predominantly inside of the subconscious mind. So, the subconscious mind is the part of the mind that works underground. It's unconscious completely, and some people might think it's a place in which is lying dormant or asleep at the wheel. And in fact, that couldn't be further from the truth. The subconscious mind is really kind of running the show. So it's where our beliefs live, it's where our emotions, our habits run, it's where automatic responses come from. It's kind of where we store our primitive stuff, like our fight and flight responses. Those types of things live in the subconscious mind. And that's important to note because it's old. It's an old place. It's the oldest part of our mind, and so it's the most well worn. It's the place in which we kind of came here with it, right? It's our cave person brain. So in hypnosis, we work within those realms rather than abandoning those realms. We bring it to the forefront. Some people find this to be kind of scary or weird because they're like, "Well, what's under there? I don't want to know what's under there." And, no. But what I think is it's already doing everything. Like it's already doing most of the work. So whether you acknowledge it or not doesn't really matter. It only makes you more powerful if you acknowledge what's going on under the surface, or if you know what's going on under the surface, or even make friends with it somehow. Right. So in therapy, you're often working to put words and feelings together. Right. And in the subconscious mind, language doesn't live there. Language lives only in the conscious mind. So it can only go but so far. And you'll get to the end of therapy sometimes, and your behaviors will still be completely intact as if you'd never even gone to therapy. Maybe you understand why you are the way that you are, but your behaviors are running exactly as they were. So let me give you an example. I have had a lifelong medical phobia. The difference between a fear and a phobia is that a fear has an origin. It's logical. That happened to me before, and so I'm afraid of it now, right? A phobia doesn't have a known origin. And so I had a phobia. It was so bad and has been so bad for my whole entire life that I thought something must be living deeply underneath the surface that I don't remember. And I would like to know why I have this phobia. And so I have gone through in my life about 15 years of deep trauma therapy. And at the end, I knew a lot more about myself. I understood so much more about myself. But my phobia was alive and well. No real movement. The way that my phobia presents itself is through mostly IVs and blood draws now, but before it was dental work. It was straight up white coat syndrome. My blood pressure would be high when I would go into the doctor's office when my blood pressure was never really high. And I just couldn't take it. I was in so much distress every single time I went to the doctor. So I just stopped going. And there was a big time in my life in which I just completely abandoned my body. I acted like my body didn't even exist. So I understood through lots of trauma therapy that I had childhood trauma, that I had all of these things occur in my life, but it didn't push me through. And I was about to turn 40 something, and I needed to go to the doctor. Like, I needed to know if there was something going on with my body, but I physically could not. So when I started doing hypnosis work, something major shifted for me almost immediately. And I was like, what the heck is this? Like, what is this weird wooey shit that I'm doing? And I mean, I'm an Aquarius, so that kind of tracks, but whatever. I was kind of still a skeptic at the time that I started hypnotherapy, but it started to work. And not only did it start to work, but I was able to go to the doctor with little to no anxiety at all, sit in a room completely resourced and tell the doctor that I deal with this very deep anxiety and fear. And the fact that I'm even there was kind of miraculous. And I had been doing hypnosis and it has been helping. And I still, to this day, as a hypnotherapist, do hypnotherapy on this particular issue and so much more. So while I was in talk therapy and even trauma therapy, my phobia never really shifted. My behaviors never really shifted. Even my behaviors around like relationships and stuff didn't really shift. I just was more aware of the language and the why behind what I was doing. And this is where I think it's important for you to have a therapist in your life. Go to therapy because that language is incredibly important. In hypnosis, you don't have to really work as much. You don't have to work to understand things. It bypasses the overthinking or the critical mind, and it works directly in the part of the mind that appreciates symbols, it appreciates metaphors, it appreciates feelings, it's connected to the body. That part of the mind is also very powerful and doesn't get a lot of care. It did when you were a kid, but these days it doesn't really get a lot of care. So, the other thing that I think is important to mention here is that talk therapy can take months, years, decades to see even the smallest shift in behavior, not of perception, but of behavior. Okay. And so that makes it a little challenging. And in some cases, it makes it inaccessible because some people can't afford to do therapy for months, years, decades. And so they kind of need something that will start working a little quicker, right? So let's say you have a wisdom teeth extraction coming up, a surgery that has to happen, and you know you have to get through it. Talk therapy will not get you closer to having to do that timeline thing, okay? Hypnosis will. So it's kind of like there's two separate tracks of why you would do one versus the other, and when and how, right? I don't think that anyone really necessarily needs to do one versus the other. I think that doing both is actually super helpful, but everyone's going to have their own opinion about that. So, hypnosis is fast. It works pretty quickly, pretty efficiently, and the subconscious mind does most of the heavy lifting. It's not uncomfortable at all. In talk therapy, it can be a little uncomfortable. You might have to relive some things and tell your story, and you might have to tell it multiple times. You might have to tell it to multiple people until you find the right therapist. And some people are just not into it. Some people are not into having to tell their story or retell their story or go backwards in time. Anyhow, talk therapy relies on recall. It relies on storytelling. It relies on you being super vulnerable and telling things that you might not want to necessarily talk about. And hypnosis does not rely on that at all. You can bring up things if you want to, but you don't need to. We don't need to know your whole past history to help you move forward, not even a little bit. I have a client that is so amazingly interesting and powerful, and I adore them so much. They have a form of secretive OCD. This isn't their story, but let's just use an example. Okay. So turning on the light switch over and over again, but secretive OCD would be that no one knows. No one knows that they actually turn on and off the light switch, and they won't tell anybody. And that's for them to know and no one else to know. So that would be challenging for a talk therapist to help with, because if the talk therapist doesn't know the behaviors, then how can they talk about the behaviors, right? So in hypnosis, I don't know any of this person's behaviors at all, not even one of them. And we work in resourcing and work in and all around the behaviors. And they have found a significant decrease in behaviors. Lo and behold, and we never have even spoken about the actual behaviors. Something that I think is also important to note about therapy is that in therapy, you're going to get tools, you're going to get strategies, you're going to get practice inside and outside of the session, talking and explaining and communicating. And those things are so incredibly valuable, absolutely valuable. And I wouldn't be here today if I did not have some of those tools. In hypnosis, the change also happens inside and outside of the session, but most of it is done inside of hypnosis. You're always hypnotized every single time you go see a clinical hypnotherapist. There's talking in the beginning, and then there's always hypnosis in the end. And we allow the subconscious mind to do the heavy lifting there. And you might not notice anything immediately once getting off the call, except for that you're really relaxed. But over the next couple of days or weeks, you'll probably notice that some of the things that used to bother you aren't bothering you as much, or the ways that you used to respond are much different than they were before. And it's such a subtle change that you might not even notice it, but other people will. Like, you're doing something different. And you'll be like, no, not really. So it's really subtle change, and it feels so good that you won't even realize that anything's really happening. Another thing about hypnosis is if you've intellectualized all of your feelings, if you have talked about it, you know about it, you have a lot of tools, but you're still feeling stuck, it might be a subconscious issue. And talking might not be helpful anymore. You might need to get into the body now, get into the tissues, and get into the deeper parts of the mind. And when that happens, oftentimes a big movement or big momentum happens in talk therapy too. So these are just some of the things that I like for people to know about the differences between talk therapy and hypnotherapy. And if you have any questions, if you want to talk more about this, if this is interesting and fascinating to you, then leave some questions, leave some comments, reach out to me, DM me, email me. I want to hear from you. Follow along, like, share, subscribe, and thanks for being here. Mwah.